Morning, my name is Gerard Green. We're here in September, and it gives me great pleasure to speak to Tom Love this morning. Tom is a sports therapist. He is also a specialist in lymphatic drainage, but the reason we're speaking to Tom today is that he is also an expert in Google AdWords and SEO and all things Google. And apart from his clinical role, Tom is really brilliant at working with clinics and kind of clinics like ourselves here in Birmingham and London to really get them with a much better Google profile. So Tom, do you want to just tell us a bit about yourself? Because people will probably be wondering, how does a sports therapist, lymphatic drainage specialist end up doing Google AdWords?
Yes, that would be a good question. So I started out as a sports therapist around 11 years ago. So I did a degree in sports therapy and started to treat patients with musculoskeletal issues. I then went in to do a lot of different things with rehab, movement neurology, and then found myself going more into lymphatic drainage work. So starting to treat patients that kind of post-cancer treatment, or patients suffering with lymphedema, or post-surgery. So how I came to the Google ad side is I'd been working with myself as a clinician for quite a while and had my own practice for about 10 years. I started to realize that there weren't many people that were working in the Google Ads area, specifically within the therapy field. And when I was looking for people, I was getting quoted quite high prices because they needed to look a lot more into the industry to find out what keywords, what people might be searching for. So I decided that I would study it myself. I also had a background, I did a degree with a business and marketing aspect as well, separately. So I was already quite interested in that area. So I started to, and it was trial and error initially, learning how to do the Google Ads side, but also studying it alongside that as well. And quickly I found that it was the most effective marketing method we were using. And for me, then it became the sole marketing method I would use in comparison to others.
Yeah, because I think, like, obviously you've done some amazing work for us and you're still doing a lot of really good work for us. But I think what's put me off in the past is I've spoken to other people who do SEO, but they don't really know anything about physiotherapy. They don't know anything about pelvic health physiotherapy, and they don't really know much about my clinics. Whereas I think from speaking to you, you automatically know what a physio does, what a sports therapist does, what a sports masseur does, what male pelvic health is, you know, what female pelvic health is. So I think you kind of save all that time in spending so much effort explaining to someone what you do. So I think it's just been easy for me to find someone like you who knows what we do, rather than wasting a lot of time going through that. And getting into Google. So we hear a lot about SEO, search engine optimization, kind of very basically, mainly for my benefit, what is that and why is that important?
So if we look at, there's two ways that we could be found on Google, two popular ways. So the first is SEO work. So that's us being found organically without any of the paid ads. So if we look at search engine optimization, we would look at things like, increasing our organic presence. So what keyword phrases are we using on our website? Do our keyword phrases match what people are searching for? And then there's things that we can do to enhance that. So if we're blogging constantly on the website, Google starts to see this as regular important content, and this starts to enhance our growth. And also other websites pointing to us. So how relevant is our website? How popular is our website? And those areas tend to contribute to that natural organic growth. And we compare that to the Google Ads side, or the pay-per-click campaigns, which is a quicker process. So I'd say search engine optimization is a lengthier process that we might look at over time to increase our natural visibility on Google.
So that is really how a website is built, what terminology is used within the website, and what content is on the website.
Yeah, so if we wanted to be found, for instance, say we're musculoskeletal physiotherapist and we're treating back pain as one of our areas. So we want to use that wording quite frequently or at different points throughout our website. And we might even also link that to the area back pain, Birmingham. So we want people to find us, and Google will see how relevant is the wording and the information on our website to what our potential patient is searching for.
And then that follows nicely into our next question, is why are AdWords so important?
So I think Google ads are important because they get us to the top of Google a lot quicker. So if we look at how people search on Google, and a lot of people won't go beyond the first page. They might not even go beyond the first half of the page. Wow. So if we're not ranking organically, and that can take quite a long time for us to rank highly organically, and depending on a lot of factors and the quality of our website. Google Ads is a quick way for us to get towards the top of Google and get in front of our potential patients. So the way that works is we basically say to Google, for these keywords that we're going to input, I want our ad to rank at the top of Google for those keyword phrases. So again, it might be someone searching for urinary issues, or it might be someone searching for back pain. We want to say, when someone searches for these keyword phrases, we want to rank towards at the top of Google. And Google will say, that's fine, but you pay per click. So they're called pay-per-click campaigns. So you don't pay unless someone clicks onto that ad. But what the ad does is it gets us towards the top very quickly.
And I think I've known for I'm going to make a confession here. I've known for a very long time that I should be doing Google AdWords for my clinic in Birmingham and also my clinic in London. Mm-hmm. But I haven't, because I just felt, where do I start them? And obviously meeting you has just transformed that. But why do you think clinicians like me, or practice owners like me, procrastinate and put this off for so long?
I think, one, it's knowing which marketing methods to utilize. We've got a lot of options. We've got social media ads, we've got leaflet distribution, we've got kind of natural utilizing Instagram and Facebook to share offers. There's so many different options, isn't there, marketing wise? And I guess it's knowing which one is going to be more beneficial to us for the amount of money spent. And I think that's what confirmed for me from using Google Ads was it was a relatively low cost for what we're getting. So if we say, for instance, a customer, say a session is £60 an hour, and we say on average a customer will have 5 sessions with us. So we work out that, and then we think, okay, well, we work out that customer will cost us around £5 to get. Then it's a kind of no-brainer that is a good investment in what we're doing. So I guess it's people knowing that it can generate that amount of work for them at that cost. So what I tend to find, or what I say to people with what we do, is they're not tied into anything, but our results will speak for it. So let us do the work, and you can see the customers that are coming into your clinic. But I guess it must be, or I think it's that there's just so many different options, and it's knowing which one is best to spend your money and time.
And I think also, Tom, it's also really finding someone, like I've said this to you before, and I mean it. It's also finding someone who you feel understands what you do and also that you're confident in them, and that you can kind of get hold of them when you whether that's like, you know, we meet a lot on Zoom, whether you meet them on Zoom, or it's all, but it's, I suppose it's having that confidence that this person understands my business, this person is someone I can work with, and that's really hard. Like it's hard to find those people.
Yeah, I think you've got, with Google Ads, you've got a lot of large organizations that run ads for people which maybe don't have knowledge of the area, but also it's the time. And I think what I pride myself on is spending time with the people that I work with to make sure we get the best out of it. And I think that's important. It's not a rushed service, and people can ask questions, and you are connected at the point through this journey.
And at the minute, so just to let people know how it works. So at the minute, we are running two very focused Google ad campaigns. We're running one on pregnancy massage, and then we're running the other one on postnatal physiotherapy. So I think I was surprised how focused these would be. And we've had brilliant results from both. But why is it important that the ads are so focused?
Well, I think the mistake a lot of people make is they make one generic ad and think that that will be enough to generate business. I think as a customer wants to know that you can help them with their specific issue. So obviously we're looking at those two areas, pregnancy massage, postnatal. If we're then looking at general musculoskeletal work as well, they're different areas, and we need to let that potential patient know that within this ad, this is how we can help you with your issue. And then we tie in each ad with different keywords. So it's just very relevant to what people are searching for.
And how long in your experience would you normally have to let an ad run for? I know this is a difficult question to ask, to answer. How long would you normally let an ad run for before you might see some results from it, or think, well, this ad needs to be tweaked a little bit?
Yeah, I think in terms of generating results when you first start, I normally find a week and a half to 2 weeks to really start to generate. But then what we do is month on month, after analysing data, we will look at how that ad is performing. And I think from my knowledge of working with all these areas previously, I know generally how they perform in what area and make adjustments. But it might be that they perform slightly better from one area to another. So we might have to make different changes depending on the circumstances. So it can just be quite focused and specific on that particular clinic and where it is.
So obviously I can monitor as a clinic owner the success by the amount of patients that are booking in.
Yes.
So I can look at it from that end point, but how do you kind of monitor how successful the ad campaign is, and how do you then decide, okay, this campaign is going well, we don't need to do anything with it, this campaign needs a bit of altering? So what metrics are you looking at that kind of back end?
So we basically link the Google Ads to Google Analytics, which give us a lot of information. So we could say that our goal is for obviously people to click and go straight through to our booking system, and we can measure that. So that's our goal. We can see how many times someone has gone through that ad and clicked on the booking system. We can measure those so many different factors. So we can start to look at what area people are coming from. We can look at the demographics. We can look at age. We can look at specifically what people have been searching for. And then if we're being more specific, we can then start to cater our ads to the population that are searching for them. So to save wasting ad spend, we can then be quite direct with who our ads are then being targeted at. Initially, we go quite broad, and then we see where our customer market's coming from. And that can also depend on the amount of ad spend. So if someone's got very little ad spend, we want to be quite targeted, so we're not wasting money. But Google Analytics will give us information, and we can start to have a look at how long people are spending on the website, what pages people are going to, what the last page someone's gone onto. So I think as well as the ad side, I start to look at, or can start to look at, the whole customer experience. And we can then start to think, do we need to change? Is it some parts of the website that need changing, or is it the ads specifically that needs changing? So we can gather so much information, and then we say, okay, well, does our ad now need to be changed in order from this information we've got? Or is it okay running as it is? Normally, I find there's some things we can change month on month. So with gathering this information, normally there's things that we might be like, okay, we can change that a little bit. It might be that we run split ads. So we start to run ads of the same focus area that are competing against each other. And then we start to see which one of those is performing better. And then we might say, okay, well, now we're just going to go with this one ad.
Fascinating. You mentioned the importance of the clinics or clinicians' website, because at the end of the day, that's where the Google ad's going to bring them to. And I know in my experience that, and I've been through this myself, prior to my current website, my last one was not brilliant, and I kind of ignored it for 2 years. I just didn't want to look at it. And I think, there are a lot of clinicians, a lot of therapists whose websites maybe aren't brilliant. I think it's safe to say that. And it kind of stresses them out when someone mentions them, well, I can't navigate around your website, or there's no booking system, or the pages aren't working, or there's too much text. But why is that so important? Like, if you're investing in Google Ads, why is it really important that you've actually got a good website or landing page where those patients can click in and they can book instantly? Because I know you've got us to amend ours, that when people say land on the pregnancy massage page, we've now got a massive book here button.
Yes.
So why is that so important?
Okay. Well, first of all, we start with why it's relevant. So it's relevant to the quality score. So Google ranks our ads depending on quality score, and one of those factors will be the landing page.
Oh.
So how our ad ranks can depend on the quality of the landing page, as well as things like click-through rate and how relevant the ad is itself. But if we look at the landing page specifically, it's all part of the customer journey. So we want that ad to go through to a specific page that gives more information to the customer and lets them know that we can treat the condition or issue they're having. So I think the process just wants to be very smooth. So we've got a call to action, which one of them is book now. They click through, and that comes through to a quality landing page that's linked to that specific area of the ad. So say if it's pelvic health, women's pelvic health, our page is going to be focused on that and the potential issues, so they know we're an expert within that area.
And obviously online booking is, well, not essential, but it sort of is. Or at least the option.
Yeah, I think online booking now is very important. I think we find probably 50% of customers might book straight away online. And I think it just gives them the ease of use of booking of any time of night. I mean, we used to have customers, if we had late availability or cancellations, you might get a customer that's booking at like 2 a.m.
we get that. It's quite,
So it's interesting people's booking habits. And I think it's different from person to person. I find some people don't want to speak on the phone. They just want to book, get it done at that particular time. And then you've also got people that will use the other call to actions, and they want to be able to call and just clarify that you can help them with that issue that they're suffering with. So I think it just depends very much on the person, but I think giving that option is quite important. I know myself that if I go on for anything, I will always look for a live booking system, because I just want to get it booked there and then.
And then you mentioned that we all know there are multiple ways to promote a clinic.
Yes.
Or to promote what we, our chiropractor, osteopathy colleagues, sports therapy colleagues do. So how does the Google ads weigh up in terms of cost return compared to some other means of advertising and marketing?
Yeah, well, I think first of all, if we look at Google ads in comparison to other advertising, the potential patient or customer already wants our services. And that's how I think it differs very much from other forms of advertising. So we look at leaflet distribution, or if we look at digital ads, which we do as well, but we are essentially going to be distributing our advertisement to a high proportion of people that might not be interested in what we have to offer. I think Google ads, already that customer is searching for your services, so they already want that service. So I think that's the major benefit. And then if we look at cost, because I don't find a lot of people are competing within the therapy industry for ads, cost per click is relatively low. So if we look, for instance, at like Google Shopping or someone searching for Nike trainers, it would be a very highly competitive area. So the cost per click is going to be a lot higher because a lot more people are competing for those AdWords. I generally find not high proportion of clinicians actually use Google ads effectively. So therefore the cost per click is relatively low. And like I said earlier, if we're working out that a new patient costs us, I don't know, £5, and we work out that patient is worth to us £300 to £400, then it's a very relatively low cost for knowing that we can get that patient.
Yeah, completely agree.
And we don't pay unless they click on our ad. So some people might actually see our ad, but it's maybe not relevant to them. It should be because of the keywords, but it might not be. So therefore they won't click on it and we don't get charged. So there's got to be some interest there for us to get charged.
Google reviews I run several pelvic health physiotherapy net groups, Facebook groups, and Google reviews it's a bit like Marmite. Some people love it, some people it drives them crazy. But yeah. It also depends where you work. So here in the UK, we are able to promote clinics, do Google reviews. Some other countries aren't. That's nothing we can do about that. But for the people who can use Google reviews and whose professional bodies allow them to do that, how important are Google reviews? Because I know personally, I go through phases. I go through several months of we will really get loads of Google reviews and then I'll forget it for a year. So how important are Google reviews?
Well, I think that just...
So I'll just ask that question again, just a bit of a technical glitch there. So how important are Google reviews?
Yeah, so I think Google reviews are important for two different factors, or two main factors. The first is that depending on Google reviews, that can increase organic presence, so the likelihood for us to show higher up in our Google ranking. So that's a great idea to invest in getting people to do Google reviews or customers to do reviews. The other area that I find is that if we link it to our ads, a lot of people will want to know that you can help them with their particular issue. And they will also want to know that other customers have liked the service you have to offer. So I find sometimes people will go on the ad and they might think, oh, we'll go and have a look at this person's business page in Google reviews because we want to know that, yeah, that they've got good credibility. So if you've then got reviews that are related to different areas of the services you have to offer, I think a patient is more likely to go with your service. So I definitely think it's good for clinicians to ask their customers to write reviews because it just increases that credibility we have as clinicians.
And then the next question fits in well with what you've just said. Just for people who maybe aren't clear here,
yeah,
what is a Google business page? Because it's critically important.
Yeah, so we can create a Google local business page. So this just allows us to be able to be found on Google easier. And you've also got, when you search on Google, sometimes your Google business page might come up on that screen, or it might be that it comes up in a listing on the left-hand side or the right-hand side. So it's important to just scope to be found. And I think the way it's kind of changed, or what you can now do with your Google business page, is you can add so much information. So you can add pictures on there, you can add updates, and it all just helps increase your presence on Google.
Yeah, we find it, and you can put the reviews on there, or the reviews are on there.
Yes, yeah. It just helps to link everything together, allows you to be found, it links to your reviews, and it just starts to generate more credibility. And I think ultimately allows your potential customers to find more information about you. So if you can put any updates on there, any offers, any information on opening times, it just means that customers have as much information as they can about your business.
And where is Google going in terms of kind of what's changing in Google, and what new things are coming out, and how might that be relevant for us as clinic owners?
Yeah, so if we look at Google, basically wants us to be able to get in front of relevant customers, and it wants customers to be able to find what they're looking for. And Google is always increasing ways in order for that to happen. So you can now use like Google display networks. So not only can our ads be displayed on the Google search itself, but it can also be displayed on other relevant websites and also YouTube. So Google is just increasing the scope for us to be able to be found in different areas. And I think that's great. And normally we just use the search area, but the option to be found on multiple different areas is obviously quite beneficial. And I think also Google wants to protect its customers, but it also wants customers to be able to find you. So as clinicians, it's great for us because as a business, it's more likely over time Google starts to work on algorithms and us being found for our relevant industry or keywords.
I think what I found really interesting when we've had our meetings is the terms that you can't use for AdWords, which kind of was a real revelation to me. Do you want to just talk through that? Because some of the key terms that I would think, a bit like I said to you, okay, these are the things that maybe we could use. I know very little about it. And then you said, actually, Google doesn't allow that.
Yeah, so Google restricts certain wording and areas. So I think what Google wants to stop is advertising that capitalizes on people's poor situation. So what it tries to prevent is targeting at what Google seems to be long-term health conditions. And it also prevents wording on bowel issues, sometimes genital issues, urinary issues, which is obviously when we're looking at the pelvic area is quite important. It doesn't mean we can't target those keywords, but it just means that we can't use certain wording on our ads. So I've obviously spent quite a long time on this, so I know what ads will get accepted and what won't, which can sometimes be quite time consuming for people.
And I suppose that also highlights the importance of getting, like, I think the importance of getting someone like you to do it rather than someone like me to do my own, where I would automatically think, if I was doing female pelvic health, I would think prolapse, pelvic organ prolapse, urinary incontinence, bowel dysfunction, female pelvic pain. So I would think, but obviously if I do that myself, then Google's just going to wipe those out.
Yeah, so the ads get disapproved, and then you have to go through and try again and look at their kind of their terms. But Google, yeah, it doesn't allow those certain words to be used within the ads, which is why the page it links to then is quite important. So we can tailor our ad to focus on those areas generally without being specific with those terms, and we can use different terminology. But then obviously we want to link it to a good page that actually then does explain those key areas so that customer knows that we do focus on those. So yeah, it's just knowing what words we can't use. There's a lot of guidelines with the whole health and well-being area, not just on physical therapy health, but also the mental health side as well. So it's just knowing what we can't say. And then once we know what we can't say, we can tailor it with the words we can use. But we still want it to be effective. So we still want to be using terminology that relates to the area.
And before we tell people where to find you on Google, Tom,
yes,
and I'll do that in a second, and we'll put obviously your links up with the recording. But
yeah.
Is there anything that else you'd like to say that I haven't asked? Because I'm mindful my knowledge of this is on a very steep learning curve.
Yeah, I think we've covered the main areas. I mean, we can go a lot deeper into the ad side and how it works, but I think for the moment, just giving people the relevant information is important. But I just think whether people get someone to do it or not, I just think it was one of the most beneficial areas for me to have explored as a clinician owner. And if we think about time, I spent a lot of time initially on Facebook and Instagram and trying to put out different offers and share pages, and it's a lot of time spent as a clinician where you want to be working on patients. So to have something that just creates a consistent lead of patients coming in without you having to do anything, I think is quite a beneficial area.
Yeah, like, and I've said it before, but like finding you, it's almost like a weight has been lifted of me, because I just, all I do now is say, okay, we want to focus on this aspect of the clinic, and then you just do it.
Yeah, and I think what I say is our results kind of speak for itself. So people aren't tied into anything. So if anyone wants to have a chat just to see what it is that I actually do and how I can help, they can book in with the link that we'll put on, or if they want to ask any questions in general. But yeah, happy to help.
And Tom, where do people find you apart from on Google?
So my website is the digimarketingclinic.com. So that's DIGI marketingclinic.com.
And we'll put that in. We'll put a link into that.
Yep. And then they can book in. I've got a section which says chat to us, and people have a link there to my diary. So if someone wants to just book in just to see whether I can help, or if they've got any other questions, they can book in on a 20-minute slot on there, and I'd be happy to help and answer any relevant questions. So yeah, that's how you can find us if you like.
Brilliant. And yeah, I've just put Tom Love into Google, and I know obviously I've looked, but it's come up. So so well done, yeah, you.
That's a start.
Right, Tom, that's brilliant. We're also
going to be at the Therapy Expo. So if any therapists are there and want to come and have a chat in person, that's in November. So we will have a stand there as well.
Excellent. So a big thanks to everyone for listening. A big thanks to people who submitted questions via the various channels for Tom. We appreciate that. And a really big thanks to Tom, both for the work he's been for my clinics, also for taking the time out to do the interview. And Tom, many thanks.
Right, and thank you for having me on the podcast, Gerard. Great to speak with you.